Well, good evening, everyone. Again, thank you very much for attending this webinar. We're pleased to meet you all. I'm going to be talking to you today about how to treat attentional disorders with flashing light. Now, that sounds kind of hokey pokey, doesn't it? I remember when I got into flashing lights back in 1984, when I developed a device to help a performing arts instructor at the University of Alberta. He had heard of this technique and he wanted to use it for hypnotic induction to help his students overcome stage fright. To me, it seemed like a pretty silly, far-fetched concept. And I was working at the time in dentistry doing TMJ research, so people would know jaw pain and making splints for them and stuff like this. And I built a research lab. And yeah, we had quite a few clients or quite a few patients who clearly had emotional TMJ. It wasn't dental, and no matter how many splints we made, we were not going to get them better. So then I started putting our patients on flashing lights, light and sound, and surprisingly, I took patients who had chronic pain for 10 years and had them pain-free in 10 to 15 minutes. So then I got excited about flashing lights, and then I've been pursuing it ever since. And it turned out that what I thought might have been a bit of a new age scam actually has scientific validity to it. So I'm going to show you a few things about it. This is really condensed down. This is normally a 2-day course, and I'm knocking 3/4 of my slides out so we can squeeze it into the next 30 minutes. So let's get into a little bit about the physiology of audio-visual entrainment. That's AVE. And that's flashing lights in the eyes at certain frequencies in the brainwave range. And the same thing with sounds, bup, 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 kind of sounds in the ears. And again, at a brainwave range. So we're going to get into that and talk about it a little bit, just for 10 minutes or so. Then we're going to get on to all the stuff regarding ADD and ADHD and so on. So what happens when you take a light and then you strobe it? And this would show different frequencies of light and also different colors. Well, believe it or not, the concept of flickering lights driving brainwaves was discovered in 1934 by Adrian and Matthews. And since then, there have just been thousands of studies looking at brainwave stimulation, flashing lights in, brainwaves out, and things like this. It wasn't until the 50s that they started looking more at the subjective and cognitive effects of brainwave stimulation, which we're going to go through very quickly. But these are some of the studies that have been done over the years. ADD, TMJ, pain, hypnosis, heart rate variability. It works extremely well for PTSD and trauma and for calming, and we use it for heart rate variability all the time. Used for ADD, putting people into sort of like meditative trances, for seasonal affective disorder, treating fear, and so on. Concentration, memory in college students, worry in college students. We have several senior studies as well showing that we can actually reverse cognitive decline. And in one study, we've got a complete rehabilitation of a lady with Alzheimer's. So we're hoping to do some more research on that in the future. But here I was with my wife back in 1984 when I had hair. And probably the business is what partly made me lose it all. But, and maybe some genetics, since I do have bald uncles. The big device you see here is the first one that I built for the performing arts instructor. And then we've made all kinds of devices since then and miniaturized them and so on. Some things about flashing lights that have taken me 30 years to accumulate. You can adjust brainwaves, because that's been known for a long time that you can drive brainwaves up and down. And it's been known for quite a while, too, that you can put people in hypnotic trances or deep states of sort of meditation. You can calm down the nervous system extremely fast, which is why it's used a lot for triage in people who are having panic attacks. You can settle them down very quickly. It increases cerebral blood flow, and so many disorders, including ADD and ADHD, are hypoperfusion or low levels of cerebral blood flow. But other things, that, especially when you look at concussions and things like this, where lactate and ATP, adenosine triphosphate, in the brain shut down following what they call reactive gliosis, which is an inflammation period that the brain often goes into following viral infections or bacterial infections and concussions. And this shutdown of lactate and ATP are energy systems for the whole body, not just the brain. And they shut down. Neurotransmitters get really shut down, especially good ones like serotonin and endorphins during stress. And glia, which are supportive cells in the brain, often shut down as well from stress, which entrainment drives up. We're going to kind of skip that section though. And heat shock protein is something that entrainment drives up as well. And that too is an anti-inflammatory that is good for the brain. And so flashing lights do all these things. You just wouldn't have thought so. So what is the difference though between entrainment and stimulation? Watching TV is audio-visual stimulation, and odds are clinically it's not going to help us a whole lot. If anything, especially if you're watching politics or some news and things, you can actually get quite stressed out from it. So entrainment is where you have a pretty steady pulsing flashing of lights or sounds. You can even do tapping of hands or things like this and get entrainment from that too, where the brain waves will follow the frequency of the stimulus. We've also found over the years that if we randomize it a little bit, it actually makes it quite a bit more effective. So we do randomize our flashing lights and sounds by up to plus minus 1 hertz. So that would mean if we were flashing an alpha at 10 flashes per second, we would bounce around actually between 9 and 11. It's actually more effective than just sitting at 10. Entrainment drives the thalamus. The thalamus is our sensory gatekeeper. All of our senses except smell route through the thalamus, and the thalamus is innervated to the whole cortex, the whole brain. So if we pulse the thalamus, it will pulse the brain. And we do that with auditory. Well, we'll skip that. I didn't mean to have that slide in there. So here's a study here by Lubar and Frederick showing that photic stimulation or photic entrainment, PE here, increased brainwave activity by almost 50% on the top of the head when they were using 18.5 hertz, which is kind of in the beta band. Auditory entrainment increases by 21. That was eyes closed, and eyes open auditory entrainment increases by 27%. So that's an example of driving up brainwaves. This here too is another way of looking at brainwaves. Now, here's my little arrow. Good, it works. So these are your delta brainwaves, your theta brainwaves, and here getting into the alpha band, what they call sensory motor rhythm band or low beta. Relaxed attention is in here, active attention, and so on. And here we're flashing the lights at 8 hertz. Right here, and you can see there's a very strong component of driving the brainwaves at 8 hertz. Because we were not using a pure sine wave, and I'm not going to get into all that, we made a second harmonic at 16 a little bit down here. Well, I should be able to use a marker, shouldn't I? Wonder what would happen if I used a marker. Just make a mess of my screen? Well, we'll find out maybe in a bit. Whoops. So here's another example of someone who's really deficient in this frequency band right here. And you will often see this band, this is more of the sensory motor rhythm area band. You'll see often low levels of activity there in ADHD kids who are hyperactive. And this is with entrainment, and you can see here within a half an hour, all of that activity that was deficient now is filled in when we gave them those frequencies that they needed. Other things have shown that entrainment in the theta band can improve memory. And here they're showing that entrainment in the theta band was driving up frontal theta, and in the process also was helping these people to consolidate memories. And when they gave them white noise, their memory recall and false recalls were not nearly as good as when they gave them 5.5 hertz at theta. Theta has been linked to memory consolidation. Something else about entrainment which is really fascinating, flashing lights inhibit the half frequency of stimulation. This is an ADHD boy who has high theta in his brain at 7 hertz roughly, which is very typical of ADHD kids. Also dementia will have high 7 hertz. Gave them 14 hertz stimulation, so twice the frequency, and it immediately squashed all that bad activity that was in the brain. So it inhibits the half frequency of stimulation in the 10 to 20 hertz band. So you can inhibit bad theta and bad alpha, or bad alpha. I don't like the word bad, but certainly alpha and theta that are way too high and excessive and need to be taken down. And it does it very quickly, as you saw. It squashed it down all in a couple of minutes. It's very quick. We use field stimulation, and you can see here these glasses. We do the left fields at one frequency and the right fields at another for some of our stuff, especially for things like ADD and cognitive decline and depression. And if you have two fields in one frequency, so two right ones, like A, like see letter A on two right sides, flashing at one frequency, they will go to the other side of the brain. So in this case, stimulation on the right hand, fields of both eyes, goes to the left side of the brain, and stimulation on the left side go to the right hand side of the brain. And the reason why the eyes have fields is because, like our right arm, for instance, is tied to the left brain. Our left leg is tied to the right brain. But with eyes, the right eye does not go to the left brain, and the left eye does not go to the right brain. It's the right fields. And the reason why is because the left hemisphere and the right hemisphere of the brain process information very differently. And it's important that what we see gets processed by both hemispheres. So this allows us to lose an eye, and the information we see in the other eye will still go to both hemispheres. And that's why fields, well, you can stimulate fields that nicely. Now here is something that we call dissociation and restabilization. The person has all this clutter in their mind, and you flash the lights, and they get calmer and calmer and calmer until finally they're in a deep trance. And they get extremely calm when they're in that trance. So it's used a lot for trauma, post-traumatic stress disorder. It's used a fair bit in the military, police, and so on. I'm going to skip this one. But here's a study showing, this is way back way back into the 60s or 50s, showing that entrainment puts people in deep hypnotic trances. And in those days, they were doing a lot of hypnosis work with flashing lights. They could trance people very fast. You could shut down a racy head very quickly. Now here's an example here of that exact thing. These people here get a lot of anxiety when they kind of lose control of what's going on in their life. So they put them on entrainment. These guys have dissociative anxiety, and when their anxiety, their dissociation doubled, and their anxiety doubled, but their heart rate still slowed down. Normally, if your anxiety goes up, your heart rate goes up, and in this case, it actually went down. And they were able to show that there was still a relaxing effect, even if people felt anxious. Now, the hypothalamus is an important player in the brain. It regulates all of our body functions, everything. And it's also involved in the flight or fight response. And so many people nowadays are under stress, financial worries, work pressure, driving in heavy traffic, stuff on the news. We're just getting bombarded with stress-evoking stimuli constantly. And it's very difficult for us to stay calm. Well, entrainment seems to break this loop. So basically, stress activates, it's called the hypothalamic pituitary adrenal axis. And eventually it gets to the hypothalamus, through the pituitary, it activates the adrenals, and then we have cortisol release, and we have adrenaline flying in our body, and so on. And that just exhausts us. It's been well shown, in amongst elite athletes, like Olympic athletes and so on. If they start to fatigue their adrenals, they don't win competitions. And that applies to all of us in life. Work gets hard, family, social interactions, dealing with our children gets difficult when our adrenals are fatigued. And entrainment seems to break that pattern extremely fast. Here's an example of this. This person has very cold fingers from stress. Put them on a session in the alpha band, and at about 6 minutes, when they start to drift off into this sort of meditative trance, the fingers get extremely warm. The arteries relax and they get warm. This is with the skin conductance. Normally when we're stressed, we get sweaty. And this shows how quickly all that sweat activity settles down. This is tension in muscle tension. And this is the forearm of a golfer who gets stressed all the time and he can't golf well. Put him on entrainment, and that tension in his arm disappears very quickly. Entrainment drives up cerebral blood flow. And fascinatingly, it drives it right up in the 7 to 8 hertz range mostly. And that is also where ADHD and cognitive decline and dementia, those are the frequency bands that their brains are often making now because they've slowed down and there's a lack of cerebral blood flow in the brain. And entrainment in that frequency band, I mean, across the board, it drives up blood flow, but it really drives it in that lower alpha range. And I'll show you what that means. Here's a girl here who is dropping out of university. And we see right here at 7 and 8 hertz, which is very slow activity. She has ADHD, maybe fibromyalgia. She can't read 2 paragraphs because her brain is so slow. She should be at 10. That's where she should be. That's normal alpha at 10, and she's very, very slow. And she tries to study till about 3 o'clock in the morning, and then she falls asleep, gets up at 7 and starts again. And she's exhausted, and she can't read 2 paragraphs, maybe 2 paragraphs. When we did this test, that's about as far as she got before she couldn't focus anymore. Put her on entrainment at the exact same frequencies that technically she should not have from a frequency model, but from a blood flow model, it was an excellent place to put her. And you can see what we did here. We drove all that bad activity right down, even though we gave her sort of technically what she should not have from a frequency model. So neurofeedback people always struggle with this because they always work on a frequency model and not a blood flow model. And they don't realize just how well it can work. Now, this is flight or fight. This is where so many of us are these days. When we get into flight or fight, the first thing that happens is serotonin crashes. Because we feel relaxed and nice with serotonin. Serotonin drives up alpha waves. And with alpha waves, we're a lot more relaxed. We sleep better. We fall asleep easy. We're relaxed. We just look good. We feel muscles are relaxed. All those things we saw with muscle and sweat activity and cold fingers all gets nice and normal and calm when our alpha activity is high. And serotonin regulates that to a fair degree. This is flight or fight, and this could be as simple as reading a phone bill, or kids getting trouble at school, or someone scaring you in traffic, or just being scared for whatever reasons. Serotonin crashes in about 2 seconds because it doesn't want you feeling too relaxed if you have to fight for your life, even if fighting for your life means paying a phone bill. Or who's getting elected in an election and things like this. And when that happens, norepinephrine goes up, and that's brain's adrenaline. And that's the brain trying to make us really aggressive to some degree and tough and ready and alert and sharp. And this is this is a great place to be if you're being threatened, but it's not a good place to be for weeks and months on end. It's a very bad place to be, and it will exhaust our adrenals. Entrainment, and this is a cerebral spinal fluid study done by Sheely, showed that with entrainment, and they were using 10 hertz here. Now, this was done in Chicago in winter, and of course, with seasonal affective disorder, melatonin levels are typically higher in people in the wintertime, especially in Chicago where it's overcast a lot and short days. And so they looked at daytime levels of melatonin. They dropped 6%, but endorphins went up. Endorphins are tied to feeling calm and relaxed and also pain sensitivity. And endorphins went up 23%. Norepinephrine went up 18%. So instead of norepinephrine going up a few 100%, which it does in a flight or fight response, it just went up mildly, 18%. Well, if your serotonin goes up somewhat and your adrenaline goes up a little bit, you feel safe and happy, but excited. I call this the Christmas brain. It could be happy birthday brain. It could be going to the conference brain. You're excited. You haven't seen people. Hi, how are you? Everybody's giving each other big hugs and talking and having a wonderful time when they feel safe, but also excited. And entrainment does that neurotransmitter signature. Now, this is something that's really important because we work with a lot of concussion. And people with concussion have low lactate levels, which is tied to not only poor performance of the brain, but it's also tied to panic attacks and things like this. Entrainment drives up lactate production 260% just in a few minutes. Very, very powerful. And it also, in the process of lactate being driven up, it also puts up some norepinephrine to the brain to help us be sharper. Again, not big amounts like flight or fight, just enough to make us really sharp and on the ball. My norepinephrine will be up right now just talking to you, but it's up in a good way. I'm not panicking. I've done this a lot of times. But when I first started doing this 30 years ago, I would be panicking. And I'd have much higher norepinephrine levels and much lower serotonin levels. And so now I'm pretty good. So anyway, entrainment appears to relax the mind, yet stimulate the actual and supporting structures of the brain itself. And that's some of the things that are fascinating about entrainment. Excuse me. So I'm going to end this show. Now I'm going to pop into the stuff on ADD and so on. Not panicking yet. There you go. There's one way to have fun and keep your serotonin levels high. Have fun. Some things about ADD and ADHD, especially ADHD, they're distractible, they're impulsive, they're hyperactive. If kids just have ADD because they're not hyperactive, they're just quiet because they're all tranced out all the time. Teachers will pass them from one year to the next. They may only pass with a C, but they'll kind of slough them off. But if they're hyperactive, they get attention because they're getting into stuff and they're annoying people. And then suddenly they're getting all this attention. And drug companies, of course, are really trying to benefit on this and capitalize on it. Just put them on drugs. And of course, you've probably all been bombarded with that. Now, there's a lot of stuff to say about ADD and so on that I'm not going to get into because we don't have time. But one of the things is ADD or ADHD is caused by all kinds of things. There's high levels of ADHD in cities with fluoride. And that's because fluoride blocks iodine absorption to the thyroid. And most of us are iodine deficient anyway. So if you add fluoride to the water, there's a higher percentage of learning disabilities and ADHD in those cities. So you should have your kids on supplements of iodine for sure. I carry a liquid iodine that is very powerful, and I use it 3 times a week and keeps me exceptionally sharp. So you can have causes that appear to be ADHD. Again, ADHD is a behavior, and there's not necessarily a brain signature tied to it, although the neurofeedback community have always said, well, it's typically high theta, low SMR, low sensory motor rhythm over the motor strip. And there is truth to that, but being a low thyroid, stress and anxiety, vitamin D deficiency, and other vitamin deficiencies can cause that exact signature. It's not the brain. The brain is just reflecting what's going wrong in the body. And so we should not just jump out there and treat the brain first off. We should be treating our diet and our lifestyle. What kind of stress do we have? What's our diet like? Are we eating junk food as well and just not getting good nutrition? Another thing here, this was a study here done by Boris and Mendel, showing that kids who had hay fever, when they fed them lentil soup, this is a double-blind study, and they had lentil soup with food additives or food colors, and every day the parents filled out a hyperactive index. And they found a very strong correlation with hyperactive responses to food colors and food additives and so on if the children showed hay fever in the spring. So, and that would imply probably there's an inflammatory process going on in the brain that makes it quite sensitive to foods. If your child does have, say, allergies and things like this, and they're probably best to really eat as organic as you can and stay away from basic grocery store stuff unless it's organic, because you're going to be ingesting pesticides and herbicides and things like this, which could add inflammation to the brain. If they didn't have allergies, only 21% responded with a hyperactive response. But allergic kids, 4 out of 5 had that response. Other issues like leaky gut syndrome cause all kinds of issues with ADD and ADHD type symptoms and even autistic symptoms. And I would say one of the big failings of medicine with the development of antibiotics is it didn't cross their minds that they should also be prescribing probiotics at the same time you get antibiotics, because otherwise often the wrong bacteria gets into the intestinal tract, and it causes a mess. It causes the immune system to go crazy. But also certain probiotics such as Bifidium bacteria, acidophilus, and things like this stimulate the vagus nerve, which increases brainwave alpha. It increases serotonin and alpha waves in the brain, which calms kids down. So if ever you have to yourself or your children go on antibiotics, make sure you get on probiotics at the same time to help stop any wrong bacteria getting into your gut. Will cause problems. And you only have to take the probiotics for a couple of weeks after you've quit your antibiotics, and then you should have a good established base. But make sure you're doing it. So stress, side effects of stress, 3 main characteristics. Guess what they are? Distractibility, impulsiveness, and hyperactivity. And man, do I see these behaviors in doctoral students. Doctoral students are tapping their feet, they're distracted, they can't focus on their work because they're getting all stressed out trying to get their doctorate. How many people, I'm not sure how many people have PhDs or master's degrees in this group right now, but those of you who do can attest to getting ADHD-ish as you're trying to get your degree. Same thing happens with big mortgages and financial worries, all these things, job pressure, marital distress, all these things can make a person ADD or ADHD-ish. Doesn't necessarily mean they actually truly are. But that's why you have to look at all the lifestyle factors that play into ADD and ADHD, as well as nutrition and so on, because it's a side effect of, so many other things. Here's a great little study here that was done by the Lubars, Joel and Judith Lubar, who were the founding researchers who discovered the sort of signature, though I don't like that word really, of ADHD, which was high theta activity and low SMR activity. But here what they showed, they have this child on neurofeedback, and they're trying to teach this child to suppress theta. And then the theta started going up and up and up and up there. You can see where the green arrow is on the left-hand side, on the yellow line. Well, when they see theta starting to go up, they typically have learned to assume that there's something going on in the family and the child is in distress. So they have a family meeting, they talk to the parents and the child. What they discovered is that there was a family conflict that was emerging and it was stressing out the child. And once they resolved the family conflict, all that bad theta activity went right down. Of course, some of that could just be tied to kids not sleeping well. You also see high ADHD kids around airports, subways, train stations, and so on. So people who are doing poorer socioeconomically basically will have higher levels of ADHD just because children are waking up a lot or partially waking up in the night from noises in apartments and trains, planes, and so on. And that's been well established. So you have to look at those types of factors. Here's another example, too, of a child whose theta started going up when his mother started drinking alcohol again, and those factors that was distressing a child, and so on. And when they resolved the mom's drinking, then the theta went back down again. So there's lots of ways you can have ADHD behavior without actually having a true ADHD signature that is actually caused by the brain. And so you should always be looking at, again, nutrition and lifestyle issues before we look at neurofeedback or other things. Now, the beauty of audiovisual entrainment is so powerfully relaxing, and it increases cerebral blood flow, that even if it is a lifestyle nutritional issue, it can still help the brain get on board fairly well. But don't use it as a way of ignoring or neglecting lifestyle and nutritional issues. They still need to be addressed. Now, here's a SPECT scan by Daniel Amen showing, this is the bottom of the brain here. So we're looking upwards from the bottom up. And we see the right frontal lobe here and the left frontal lobe. And we see these holes in the brain. These aren't real holes in the brain, they're metabolic holes. So there's low cerebral blood flow, low metabolism of glucose and oxygen in these spots. And frontal lobes, of course, aside from playing roles of attention, they also play giant roles in inhibition. And this is partly where the impulsiveness happens, when these are shut down. Now, true ADHD signature on passive tasks, there's an ischemic effect where these holes get worse. And you can see that here during reading. Or an attentional task that's passive. Kids do pretty good if they have ADHD, if they're skydiving or climbing or mountain biking, they do, or playing video games. If they have high levels of stimulation, it does activate the frontal lobes. And as you know, a lot of ADHD kids are darn good gamers, and they're good hockey players, and they're good climbers, and they're good adventure guys in general. Now, this child here was put on Adderall, and you can see how it closed up those metabolic holes. And that's partly how if you have sort of like the true ADHD signature, which I would say this is more so, then yes, then a stimulant drugs can indeed fire up those frontal lobes and calm down that behavior. You can see the same thing on an EEG, and I run EEGs in my office, and so here's a full head EEG. Here's sort of the equivalent. You see these alpha, theta, alpha hotspots. That would be the brain shutting down during this attention task. And post-entrainment, it cleared the whole thing right up. That's what flashing lights can do. Here's, I'm going to skip this one. I don't think we've got time to get into that. It's going to take a bit. Let's take a look at some studies, though. So here's Carter and Russell were the first group of people to look at using audiovisual stimulation to treat ADHD behaviors. And here they had 14 participants. They gave them 40 entrainment sessions, sorry. But they also recorded the audio track, which is basically a pop, 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 pop kind of a sound. And they recorded that on a cassette tape, because this is 1993. And the kids took the cassette home, and the ones who took the cassette tape home and played that also did better than the ones who just got the audio visual in his lab in Dallas, at his lab at the University of Dallas there, or U of T in Dallas. And you can see when you're looking at IQ went up 10 points on those kids who were using entrainment. And memory went up. Reading on the wide range achievement task went up. And same thing with spelling. So you see these improvements across the boards in kids who use entrainment in their academics. Another study was looking at Burke's behavior by teachers. And we can see again, too, that the students post audiovisual entrainment were far better than those who prior to. And some of the areas that are important is a sense of excessive personal suffering and poor anger control. I mean, in a classroom, if a child does something and then you scold the child and the child feels victimized, they're going to act out with anger because they feel like you're unfair to them. But if they can reason and you sit them down or you ground them or you discipline them somehow, and they can reason, then they're not victimized. They go, yeah, okay, I was wrong. I realized I was wrong and I shouldn't have done that. I understand. And then they don't have anger issues. So long as you can engage those frontal lobes so a child can reason, they're going to be far less angry. And imagine managing 30 kids in the pink bars versus the kids in the yellow bars. I wouldn't want to be this teacher here. It doesn't sound like a very good day. Now, this is a study done by Micheletti, Larry Micheletti, who was Carter's grad student. And he looked at controls, a stimulant, Ritalin and Adderall group, an entrainment group, and then a combined group on these kids. And he gave them 40 sessions of entrainment. And here he again is looking at IQ, what they call Peabody picture vocabulary test. How well can they remember pictures and things? A math IQ test, reading, and again, the wide range achievement test, and spelling. And you can see the controls really didn't have any change. The Ritalin group had a little bit of improvement. The entrainment group did much better. That's the yellow bars. And then the group that was combined with entrainment and Ritalin in the blue bars did even better again. So you kind of have stimulation on stimulation, and they did better again. Now, using this technique here, we used the session here. Now, this session here, I remember we showed that entrainment inhibited the half frequency of stimulation. So we're trying to inhibit a range of theta frequencies. We don't know which actual frequency the child is making. Is it 6.5 or 7 or 7.5 or 8? We don't really know. So when we stimulate with the lights, we're driving up the right-hand side for the left brain, because you want the left brain to be more activated than the right brain. So we're doing 16, 17, 18, well, 17, 18, 19, 20 hertz. And we're doing on the less stimulation for the right brain, we're doing to basically 12, 13, 14, and 15 hertz, or in that range, to bring up the sensory motor rhythm and also cancel out the theta on that side. And we take little dips to alpha. Now, this study was published in the Journal of Neurotherapy back in 2000, and the results were particularly impressive. Michael Joyce, who was heading up the study, had built this, had a carpenter build these boxes for him so they could wheel a 10-station system from classroom to classroom. And they had several schools using this, and they were putting the kids on it and calming them down and improving their grades and everything else. In fact, this was his first study. And they looked at, and this is on the TOVA. So the TOVA is a computerized test. It's the world's most boring video game. There is a little square that goes either high or low on your screen, and you push a button when you see it. And sometimes kids make mistakes, or they get impulsive and they click before they should, or they're just dreaming and the little box shows up on the screen and they forget to push the button completely. So it measures all these errors, and then it measures it, and it's been normalized for normal kids, right from people right from I think 5 years of age to about 75. And the 100 is your norm, and below 100 is certainly problematic. So you can see these kids were all problematic, and after 30 sessions of entrainment, they were very, very close to being normal. In fact, even less impulsive here than normal at 109. And so, yeah, the teachers were very happy, and they were treating 10 kids at a time. And the reason why they did this, I'll just go back to that slide again. The reason why they did this is Michael Joyce was using neurofeedback in 2 schools in Minnesota, and the school system was going to cut the neurofeedback program because they said it just was not cost effective. It was way too expensive for the results they were getting. So he talked them into funding him to buy a multiple system from us. And now they were treating 10 kids at a time. And not only were they treating 10 kids at a time, but their actual improvements exceeded that of neurofeedback, of 6 leading neurofeedback studies. I don't know if I've got that in here or not. I'll see if I hid that slide or not. This is looking at grade equivalent. Of course, it was a 2-month study, and these kids in the controls, their reading improved by 2 months. But the kids in the ADHD group improved significantly more, from grade 2.9 to grade 3.5. Oh, here we go. Here's the study here. So when you look at TOVA gains per session by famous authors, Rossiter, Kaiser, and Othmer, John Anderson with New Vision School, the Thompsons, who've been doing special needs kids forever, Rossiter, Levac, David Kaiser, and this was Michael Joyce's study here. And again, there's a big cerebral blood flow connection to this. There's other things that go on in the brain, stimulation of glia, lactate, ATP, and so on, which neurofeedback probably isn't doing. And as a result, not only did they have better gains than neurofeedback, but they were doing 10 times more kids. So it became quite a popular thing in the state of Minnesota. Here's a second study they did from 7 schools. And we can see here that the norm is 10. And look at anxiety, depression, hyperactivity, and inattention over roughly 30-some sessions. We can see here that the kids had major improvements across the board. And there are 204 kids in this study. And when you look at reading, especially in the grade 7 level, but across the board, grade 7 is improved by an entire year in reading during the 2-month study. And so quite impressive outcomes for these struggling kids. And well, there you go. I was trying to make it pretty quick. If you want to look at a little bit, some things about academics, I can do that too. How are we doing for time?
We're at a little past 7:30, so we could.
A few more minutes, or should I stop now?
Probably a good time to go to question and answer.
Okay, we can do that. I'll maybe show you one study here. This is interesting because a lot of kids worry a lot. Well, I'll show you a couple of things. This is a study looking at control groups versus an entrainment group that Tom Budzinski had done in Seattle, showing that the entrainment kids improved by 0.7 of a grade point average, while the controls actually went down between fall and spring. 1 GPA difference. That's memory and concentration. Now, this one is interesting because worry is a problem with students, and when students worry, their academic performance actually gets worse because of the stress of worry. So this was a study done here in Texas. Waiting list controls, they had an expressive writing group that had to write about their worries. They had one that got worry exposure. So they were exposed to worries to try to desensitize them. Then there was an entrainment group. And you can see that the entrainment group outperformed all these other techniques and in terms of reducing their worry. But because it's so easy to use, the adherence was very high. College students did not like writing or having worry exposures or expressive writing about their worries. They just didn't like it. And it was time consuming and it was distressing in itself. The entrainment group had the highest adherence and also the fewest dropouts. So it just goes to show if it's easy and effective, people get on board with it and you do very well. So I just wanted to kind of address that little worry component since many of you will also have kids who are in high school or college or junior high, and you like them to be happier and more relaxed and have better grades. So anyway, okay, there we go. Questions? Yes, please give me some questions.
Go ahead. Dave may or may not be able to hear you. The mic isn't great, so if you have a question, say it loud, and if he gets it, great. If not, I'll repeat it to him.
So these things that you come here to get are something you check out and take home and use over a period of time? How does that work?
Sure. Okay. Did you hear that question, Dave?
No.
Nope. Okay. So just as well, it's probably a question more for me than for you. It was about how to access the device, if it has to be clinical or at home. So I'll address this one. So we do in-clinic sessions with the audiovisual entrainment. We rent them. We do rent to own, or you can buy it, or you can buy it directly from Dave's got his company name up there. We sell it at the same price that Dave does. So they're available for sale, for rent. We like the rent to own program. It allows people to take it home, try it, live with it for a week or two. If you like it, what we tell people is just keep renting it until you own it. And it's nice and simple.
How often do you need to use it to make it effective?
Okay, so Dave, that question was, how often do you need to use it to make it effective?
Okay. Yes, and by the way, I would prefer that you all buy from your local clinician.
Okay.
Not from me, because you're going to have other things that you need to address and so on. So that's why I kind of took it off the Mind Alive page. I didn't want people phoning me. I want them to go to you. And that's important. So how often do you use it? We like them to use it. The best way for kids to use this is for the parents to put it on them while they're still asleep in the morning. Because then they wake up, they're compliant, they brush their teeth, they have their breakfast, they get dressed, and out the door they go with no fighting. Most of the time it works extremely well for that. And then when they don't fight, of course, they don't go into flight or fight and all the other stuff that accompanies them having a bad day. They have a good day right from the start, and you can put it on while they're still sleeping and it still works just fine. And we've done that with autistic kids too, put it on while they're sleeping. With autistic kids, though, we also typically will not put the headphones on, but we'll use computer speakers, one on each side. And the parents will put their child to bed at 10 o'clock at night or 9 o'clock at night, and an hour later, they'll put the entrainment on them. Kids don't even know it. And we've seen some remarkable improvements also with autism, not just ADHD and ADD kids. But that's the best time. You can also put it on, in the afternoon if they're stressed for some reason, or at nighttime as well if they're not falling asleep well.
And I'll add in a little bit to that to say, so there's different types of protocols. And so those are somewhat time of day specific. Like you wouldn't want to necessarily do a sleep protocol during the day. And there's, of course, constraints to this. These are general things. So time of day, so every day would be great. But if all you can get is, once a week, fantastic. But, every day would be great. It would be fantastic to do a brain brightener in the morning, a sleep protocol at night would be even better. And I like to think of it as more in a model of nutrition than therapy, and kind of think, how often do you want to eat well? Like one good meal a week and the rest crappy? Or, eat well as many meals a week as you can. And that's the way I think about things like ABE. It's a nutraceutical more than an intervention.
A braintraceutical.
There you go. I like it.
Yeah. Or a neuroceutical. There you go. A neuroceutical. Good. I like that. I'm going to keep that word.
Go ahead.
The facial expression recognition, I'm a little speechless. Sorry if I missed this, I came in late, but what kind of studies have been done on long-term, 1, 3, 5, 10 years after, if anything has been done, either to look at brain electrical activity or to look at psychosocial impact?
Did you catch
Well,
that?
Did you want to answer this or want me to?
No, I want you to. I just wanted to make sure you heard the question.
Yeah, long-term effects and a psychosocial impact?
Or whatever, behavioral. Like I'm curious, is the entrainment, are those effects, how long do those effects leave an imprint on the nervous system?
Well, initially there are a couple of days generally, but after 30 to 40 sessions, they hold. And kids will typically then after a couple of months or so, they'll use them for, because everybody needs, believe me, everybody in our life, we need to de-stress once in a while. We all have issues where we get stressed out, or we didn't sleep well, we feel a mess. I still use entrainment occasionally today. I used to use it a lot more when I was younger, just for bad days. But anyway, yes, it does seem to have a very good holding pattern. We haven't done long-term studies. Tom Budzinski did the longest one where he looked at the grade point average 4 months later and found that they did one GPA better than the controls. 4 months of no entrainment, showing indeed that it was holding 4 months later. The study that was done on the Alzheimer's patient, which I guess kind of maybe could kind of fit into the slot a little bit, showed that a year later she was still improving. And we also have a senior study that was done by Chris Palmquist looking at EEG and also short-term and immediate memory, and found that they were still improving. Even though they had quit using it, it seems to activate the brain in such a way that the brain continues to develop and grow and improve on its own. And so she showed 6 months later with seniors that it was still improving. So yeah, I think it's good. Socially, psychosocially, I mean, anybody who has a better running brain has more friends, they have better relationships, and they make more money.
Yeah.
I have only an anecdotal. I don't have any research, but I've been a classroom teacher for many years and have used ABE from the Chance to Grow New Visions training many years ago. And I have a 28-year-old son who I believe got through middle school and high school with the help of ABE. And he's now in law school and called me this week and asked me to mail him one because he suddenly realized he needs to get a little boost. I think his
Absolutely
remembered what it was like. And so he wrote and said, and some friends said that you were going to be doing this session, so I was curious. Are there schools that you're aware of now, elementary schools, who are continuing?
I'm not sure, unfortunately, like say Michael Joyce was the major push behind Wisconsin and Minnesota getting these. They had him up to 70 schools at one point, but then he retired.
Yeah.
And I think unfortunately, there are probably, I know there's still a few teachers and counselors still using them, but not like there was. Unfortunately, not like there was, no, which is a real shame. Yeah, thank you for your comments, and there was certainly a chance to grow. That was the major push, behind using our equipment.
Yeah.
And Michael Joyce was, John Anderson as well, but Michael Joyce was the major proponent of entrainment, and he just put thousands of kids through the program and did really well. On another little note, my daughter wasn't ADHD herself, but she had trouble falling asleep at night, and she would get too worked up during the day and stuff about things. She was kind of sensitive. So I put her to sleep ever since she was about 5 years old. I put her to sleep on entrainment most of the time. And by the time she was in university, she's a speech pathologist now. But in university, her marks were so high in her getting her degree, her master's in speech pathology, that the professor had to get special permission from the dean to give her those grades, because otherwise it would have looked like collusion. That's how well she did. And she could attest to how well entrainment got her through all those tough days, or the inability to sleep. You don't sleep well, you're not going to perform. And so many kids don't sleep well for all kinds of reasons. Everything from playing on their games, to tablets, to stress, to all kinds of stuff, to nutrition. Again, if you're deficient in vitamin D, you don't sleep well, and so on. But anyway, yes, thank you for your comments.
If there's more questions for Dave, I'm happy to kind of keep going. The other thing I'll just say that we have on the agenda, if we get to it, but we don't have to, is to do some small group discussion here amongst ourselves. But I don't want to take away your opportunity to hear from Dave. So I know we've got one question there, and if there's more, we'll keep going. Go ahead.
So there's a lot of research with neurobiofeedback and drug and alcoholism recovery. Is there any research with the ABE and drug and alcoholism recovery?
Unfortunately not. I've been wanting to get an addiction study done. There's a Saybrook student right now who's considering that as his dissertation, because all kinds of people with substance abuse have used entrainment to treat it. The best we've got was Ed Pygot's study. He did a study with Dennis Marakis and Greg Alter, showing that it was effective as a drug treatment program. But it was still not a large study. It was a pilot study. And I'd love to see a much larger study come through with this. Because, yeah, it does really calm a person down, especially people who are taking relaxant type drugs. Makes a big difference. Can anyone else comment on that? Can you comment on that, Guy?
I don't have anything to add. You covered what I would have said. Yeah.
Okay.
Okay. Other questions percolating? Yeah. Go ahead, please.
I know you kind of addressed its effects on people who've had PTSD, trauma, and then you also mentioned people like children from poor demographics. Has there been any research that specifically deals with like PTSD or trauma from abuse, domestic violence, things like that?
Still there's not enough. David Trudeau did a study on PTSD in Vietnam and Korea war vets. He did it out of Minneapolis. Had very good results. It was a pilot study. He also did QEEGs and showed significant improvements of the QEEGs or in the brainwave activity. Right now, we're selling for about the last 6 or 7 years, maybe 8 years, we've been selling 30 to 40 units a month to the Semper Fi Marine Fund. And they've been getting these to Marines. They've got thousands of units out to Marines right now. There's some clinicians at VA centers that are using them. The problem is that, the Semper Fi Fund, of course, aren't collecting data. And politically, the clinicians at the VA centers are very careful, and they're not collecting. They're collecting all these anecdotes, but they're really not stepping forward because politically, it just isn't fitting in with the medical model that they've got. But we do know there are several thousand people, war vets, Marines especially, who are using it. And I would love to see a study on PTSD. Yeah, that's one of the things we'd love to do. Anecdotally, we know it's working. but we have not yet had someone step up to run a study. I'm trying to get a Saybrook student again to do that right now. Saybrook students are quite good at getting on board, partly because I've been teaching a course on entrainment at Saybrook for several years now. And so we've got several students who are interested in doing research with us.
There's another question?
I guess so.
Just ahead of you, he had a question.
Yeah, is there a significant difference between the models they had 20 years ago and the current one?
Oh, the models. Oh, yeah. Oh, the technology. Yeah, it's improved a lot. Yes, and part of the improvements are the field stimulation, the randomization, which clinically has made a significant difference. In fact, the difference was over a fixed frequency. The difference was quite significant. I just actually today sent off my final edits for a patent on that because it was the improvements are significant enough that I figured I needed to protect the technology or these innovations. Yeah.
Just about Alzheimer's and cognition. You know, there's been actually some studies in mainstream scientific journals about the light flickering and the white noise with Alzheimer's. And V-Light is getting a big study done. And notice some other companies coming out with products for Alzheimer's. So it's interesting to see your research as well, affirming all that. So it'll be exciting to watch it expand.
Yeah, well, you know, I think there's more than one cause of Alzheimer's. And the V-Light, of course, is working on stimulating mitochondria, but a lot of people have brain issues, but not mitochondria issues. They have network issues and so on. The Alzheimer's, I have a 90-minute video on YouTube that gets into thalamocortical disconnect. It's a low voltage, no alpha, poor phase condition that we're seeing in a population of people both with concussion and with post-inflammatory viral infections. And they have the same signatures no matter what group. And they exhibit, for behavioral symptoms, they exhibit generalized anxiety, severe sleep disorder, like insomnia, and they all show an OCD signature on the EEG, right down the cingulate, mostly a CZ, FZ. And there are hoarders, counters, cutters, ritualists, anorexics, compulsive gamers, and substance abusers. And they're all showing obsessive compulsiveness, every single one, whether it's viral or whether it's concussive. And entrainment so far is the only technology that resolves this, and it does it remarkably well, mostly in about 20 minutes. We'll see them go from flatline, choppy flatline, just terrible EEG, to giant alpha waves in about a 20-minute span. And I think a lot of this has to do with the lactate and ATP that entrainment generates. We can't say for sure, but we know it's working really well. Becky Basham has been treating all kinds of NFL football players who just lost their lives entirely. And she's using entrainment as a form of triage with these guys. Some of them are very suicidal. Some of them are beating their family, they're beating their wives and stuff. And so she's using it as sort of a triage approach and having actually very successful results and basically mimicking the research that we're doing up here. So we're hoping to see a lot more on that. And we believe that the thalamocortical disconnect turns into Alzheimer's because studies on the glymphatic system, which is glial lymphatic system, shows that if astrocytes don't see large delta waves, they will not activate and they will not clean out the day's accumulation of protein from the brain into the lymph system. And so none of these guys with the thalamocortical disconnect can make proper delta at all. And that was the one thing we noted in Leslie Sherlin and Tom Budzinski's study with this early onset Alzheimer's is this lady she was low voltage and no alpha. I do have that study if you want to see it. And say it was one case, but that lady went from shuffling around in a senior's home to walking through downtown Seattle and was completely recovered after using entrainment. So anyway, we hope to see a lot more on that front.
Yeah, please.
you talk a lot about your studies, but I guess what I don't get from the material, we have one of your units at home and we've been using it, but I don't understand what protocol to use or exactly which program to use for ADHD or excessive anger. And there's so many options in the mood boost and so many options in the brain boost, and I don't know really which one to use. And I find that difficult, and I've tried to look online and stuff for guidance, and I don't really find much. So I was just wondering what your guidance was on that.
Well, I have a full page of studies, just article after article after article on our website.
I know the studies, but I'm talking about what program to use at home on a daily basis.
Yeah, well, all the studies that we show the frequencies that were used. And yeah, the categories are, you don't need to be specific, generally speaking. In the brain brightening category are SMR betas. They're used for people typically with slow brain waves like ADHD, seniors with cognitive decline, and also concussions. Mood boosters are for depression. And then we have the meditation section, which is, I think, quite self-explanatory. People need to calm down and get more. Those are typically in the alpha band. And then we have a couple of sleep ones as well. And so I think it's fairly laid out. To me, I thought it was, but I can certainly help you with that if you like.
My other question was the glasses that we got with our unit, it only gives the white light, and I was just wondering what the difference is between that and the, I think, older ones that use the colored lights.
I'm all for color. They work significantly better than white does. I would not use color. I wouldn't use white. All our research was done with white, but I just know that white works extremely well.
Can you just order the glasses that are colored, or how do you know which one you're going to get? Or
Sure. So so do you have the glasses that you can see through, the view-through glasses? Okay.
They look like those,
These
but
ones,
it's just
they
white
just
light.
do the white light, sure. And yes, you can order what we have here, the multi-light sets through Mind Alive, and then you can manually change the color to your selection. And Dave supplies some information on why you might choose a particular color. There's some suggestions. So those are readily available.
I thought I'd also just show here under the research tab, this is where all the good stuff is. Research tab, then research articles by Dave Siever. You click on this and we have the physiology of entrainment, stuff on TMJ and dental. That's how I got, of course, my start in all of this. ADHD, stuff on affective disorders. On seniors is Article 6. PTSD, safety and why the stuff is safe. Novel way of boosting grades in college students while cutting stress, as we saw. A good, interesting vitamin D article about how important vitamin D is for brain function. We also have stuff on transcranial DC stim, why binaural beats don't actually work. CES, a combined article that was published in most of these have been published in Biofeedback. This is the one on thalamocortical disconnect. This is the Alzheimer's case. Insomnia and sleep disorders, which I'm expanding on right now. Then we have some other ones too. I show QEGs of head injuries from heading in soccer, heart rate variability, and some stuff on EEG and so on.
Dave, do you have the...
there's a lot of stuff there.
Do you have the expanded protocol explanation? The PDF that kind of gives the longer explanation that's more geared towards clinicians. Is that up on your site?
I'm not sure what you mean by the PDF that's more, all these are geared to clinicians, and but they all cover all these different topics, right?
If it's not coming to mind, that's fine. I can get you a copy of it. It might give you more insights. It takes what's in the book, but it expands it out by quite a bit and gives you more information and suggestions for conditions that you might use a protocol for.
The protocol guide. Yeah, the protocol guide.
Yeah, that.
Yeah, we have a protocol guide, and also we have.
But is it on the site?
A questionnaire you can fill out, and it suggests which category you might want to use.
sure. That's helpful as well. But can you go to the page with the protocol guide on it, on the site there?
I don't think, it might be here. Let's see now. Yeah, this is a new, I don't get on this new
On the
website
spot,
very
yeah.
often.
Again, it might be easier for me to just email it to you, so we can send that up.
Yeah, here we'll have a few things here. One we'll have is, should be here.
So
There's the multicolored.
Here's a quick start guide here, which is a PDF. Oh no, this isn't a no, but it showed you can fill it out anyway. It's a psychometric. Suggest the category you might want to use.
It is 8 o'clock, and we like to run on time. So, Dave, you don't need to leave us, but I do want to kind of make an official break, and then if folks want to stick around, you're welcome to. We've got equipment to demo. As long as Dave wants to stay online, you're certainly welcome to ask him questions. But maybe we could just take a moment and thank Dave for his time.
Thank you.
Thank you, Dave.
Thank you very much.
Dave has been very busy traveling
Attending?
the world, presenting at different conferences, and so we were fortunate to be able to get an hour of his time when he's between world tours. So we appreciate it, Dave. And then also, again, folks, if you can go ahead and we'll call this the official end, but you're welcome to stick around, mill about, grab some more food on the way out.
Here's a personal profile questionnaire as well. You can see it on the screen here. That helps guide you as to what category to use. You can see that.
Yes, yep, thank you.
Okay.
That's on the website?
Yes.
Yes. On the website. I can tell you where. Let me just go back to that. It's under personal profile questionnaire right here. And that was, I think, under solutions, right? Well, under operator manuals. Sorry, under operator manuals.
I went to mindalive.com. I'm there right now and I don't see it.
Could you send a link over?
Operator manual. So you go to products.
There you go.
At the bottom, it's the operator manuals, and then you'll see it right in there, the top listings. See it?
I see.
Products, operator manuals, and then personal profile questionnaire.
No.
Yeah, we built that with the help of a psychologist when we made that.
I probably can. Yeah.
Well, if everybody's good, I'm gonna have some dinner now.
Yes.
Yeah.
We should let Dave go back to his family. So,
Thank you very much.
thank you, Dave.
Yeah, thank you very much for attending. I appreciate it. It's an honor to be speaking to you. Thank you.
Thank you.